Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam, a cardiologist from Houston, Texas. This Medicare update seminars are brought to you by Triple N Media, where we have almost hundreds of educational programs on our YouTube channel. You're welcome to watch those. We also kindly request you to subscribe to our YouTube channel. The feature presentation is Medicare Part A, coverage, eligibility, costs, and much more. If you are approaching age 65 and you are eligible for Medicare, then this will be the topic that you want to focus upon. Medicare has Part A, B, C, D. It's like an alphabet soup. And if we go into the supplemental insurance, you have insurance all the way from A to K, N, something like that. Then we have the Medicare Advantage plan. But we're going to make it very simple for you. We're going to start off with the basic concept of Medicare. Focus upon Part A in this presentation. In the next presentation, I'm going to be talking about Medicare Part B. The third presentation will be on Medicare Part D, or the prescription part. And finally, we're going to talk about the Medicare Advantage plan, which sort of combines Part A, Part B, and Part D together. So let us begin with the main feature presentation. As you approach your Medicare age, if you have put in full-time job and you're eligible for Medicare insurance, on your 65th birthday, you are going to be automatically enrolled into Medicare Part A, which is the hospital insurance as it is called. You will be eligible for Medicare Part B, but that is something you have to enroll in order to be covered, and you're required to be enrolled. Otherwise, if you don't enroll during the eligible period and you wait for a couple of years and then you try to enroll, you may have to pay a penalty. On the other hand, if you're receiving Social Security or railroad benefits, they automatically take this Medicare Part B premium from your Social Security check. Let us focus on Medicare Part A and learn as much as we can about Medicare Part A. The moment you go to the emergency room, you are going to be using your Medicare Part A and perhaps Medicare Part B insurance also. Medicare Part A, what does it cover? It covers hospital services. When we talk about hospital services, it just doesn't mean a big box hospital. It could be in a different situation like an urgent care, or it could be in a skilled nursing facility after recovering from an acute illness, or it could be in a hospice care when things are just not going right. And it also covers home health care. It also covers inpatient services in religious medical healthcare institutions. But most of the time when we are talking about inpatient care, we are thinking about going to the emergency room, getting all the tests done, being admitted to the regular floor or the intensive care unit, and then getting more tests done, getting medications, and finally going home. That is the concept of the hospital care which we are accustomed to. We're going to learn more about what is covered, and what is my responsibility, and what is not covered. That's more important. What is not covered is equally important. And so when we talk about hospital coverage, it's usually in an inpatient setting, but it could be in a different setting too, which I'm going to cover in a minute. Let's talk about inpatient care. That is, you are in the hospital. Inpatient care is done in a setting of a hospital. You could be evaluated in the emergency room, then you are transferred to a monitored unit or a regular floor, a semi-private room, or you could be in the intensive care unit depending upon the degree of illness that demands a special place. Or if you're delivering a baby, you may be going to the delivery room. You get the message. The inpatient setting could be in a regular hospital, or it could be also in what's called the LTAC, long-term acute care, or a skilled nursing facility that is designed to take care of patients who have recovered from an acute illness in a hospital and who needs continued medical supervision and treatment, like respiratory treatments or ICU requirements or continued nutrition. And in those circumstances, they can be admitted to the long-term acute care institutions. Or it can also be related to inpatient rehabilitation following an orthopedic surgery, following a heart attack, or following a major surgery. So these are things which are covered by your hospital Medicare Part A insurance. So what does it cover? Well, it covers semi-private room, nursing care, drugs, medications, diagnostic studies, and any surgical procedures that may be necessary. It also covers 80% of the physician's services if you have Medicare Part B. So please pay attention to every word I said in this sentence. It will cover 80% of your doctor's fee if you have Medicare Part B. If you don't have Medicare Part B, then the doctor's services that are going to be sent to you, you are responsible for paying that. Make sure that you are going to get a bill from your physicians, which is going to be covered not by the hospital insurance, but it's going to be covered by your Part B insurance, which we're going to talk in the next video. Well, tell me what is not covered. Private nurse, a private aide trying to wash grandma. No, that's not going to be covered. Television, no, you bring your own television. If there's a television in the room and you want to use the services, there could be extra costs, but that's not going to be covered by Medicare. Phone, I don't know why you would need a phone, but if you need to use a phone, like a landline, then you have to pay for the phone. Any personal care items like that you want, snacks or cookies or some supplies from the gift store, you pay for those expenses. Let's talk about dinero, mucho dinero, money. When you go to the hospital, it costs a lot of money. And who is going to pay for what? We're going to unravel that mystery right here. There's going to be, as I said, there's going to be a lot of mucho dinero involved anytime you go to the hospital. I have seen patients' bills as high as $8,000 to $10,000 for spending a day in the emergency room and then going home. So the costs are astronomical. But let's talk about what is covered and what is not covered. If you have Medicare Part A and your doctor decides you need to be admitted to the hospital because you are having chest pain, your blood tests are abnormal, your EKGs are abnormal, we are going to admit you to the hospital. The moment you're admitted to the hospital, you have an annual deductible. It's like $1,400, but it varies from year to year. That's why I didn't put the number here, but think about it. That's the money that you have to pay to check into the motel. I know it's the most expensive motel charge, but that's what it costs. So you pay for the annual deductible. Between days 1 and 60, whatever the hospital costs are, like the semi-private room or the intensive care unit, the IV medications, the nursing care, the custodial care, and everything is covered by Medicare. You pay nothing for the hospital service. However, between days 69 and 90, things change a little bit. Medicare pays part of that and you end up paying co-insurance. Again, the co-insurance changes from year to year. It could be 70-30 or it could be a totally different number. So you have to just check with the social worker or the financial representative at the hospital and say, hey, what is my damage besides getting sick? Between 60 to 90 days, again, you have a part payment and co-insurance. After you have used 90 days, in a year, you have what is called a 60-day extra period that's for the entire lifetime. It's not for each year, but it's for the entire lifetime. So you have to keep these 60 days safe just in case you need it, because once you use it, you are done. You don't have those days anymore. And here it pays part of that. Again, you pay co-insurance. Beyond these days, 90 days plus 60 days, that's 150 days, that's max, then you're out of Medicare coverage, more or less. Medicare pays nothing, you have to pay 100% of the charges for that year. But the following year, you may again start this cycle with the annual deductible and 90-day inpatient coverage. Inpatient psychiatric care is covered for 190 days for a lifetime, that is for the entire lifetime, and there may be copay also, just like with regular admissions. The physician services I already talked about. This is where you have to have Medicare Part B, which pays 80% of the Medicare approved charges. Your doctor may bill $1,000 for a surgery, but if the Medicare approves $600, the Medicare is going to pay only 80% of $600, which is $480, and your supplemental insurance has to pay the other 20% if you have that one. It's kind of building up. You have Medicare Part A, you got Part B, now you need a supplement, then you need a prescription plan. Yes, I know. Medicare is not that simple. That's why we create these educational programs so we can learn as we go. Here's another tricky thing. Most people don't understand, including doctors like me. I've been in the medical field for 35 plus years. I still have very little understanding of what is an inpatient and what is an outpatient services. But in order to cut the cost of medical services, Medicare has come up with what is called observation period for 24 hours. If it is a simple problem, which is just waiting for a lab test to come back and maybe a simple IV fluids or something that may correct an acute situation and the patient can go home, then they don't need to be admitted to the hospital and spend a whole day or 2 days in the hospital. So Medicare says, okay, we're going to admit you as an observation patient. Mark the word observation patient. And that is going to be determined by the history, the initial presentation, the lab test, and the doctor's decision. And of course, the hospitals would like most of these patients to be admitted as an observation because it's easier for them to comply with the medical guidelines and also facilitate and expedite the management of these patients. After 24 hours, if the doctor says, oh, you had chest pain, you have an abnormal test now we need to do a stress test or we need to do a heart catheterization, we are going to admit you, which is fine with the hospital, with Medicare, and it should be fine with you too because you don't want to go home with an abnormal studies when you're having chest pain. In a simple situation, if you're in an outpatient observation, the charges are going to be different compared to an inpatient charges, which I just talked to you in the previous slide. So let us look at and see what's the difference. In an outpatient situation where you are admitted as an observation patient, there's up to 24 hours, and it could be more than that, for the doctors to decide whether you need to be admitted or not. If you stay there for longer than 24 hours, then you get what is known as the Medicare Outpatient Observation Notice. They're telling you that you need more workup, and it could be as an outpatient or it could end up as an inpatient. Again, as I said, the outpatient charges for like diagnostic studies like x-rays or CT scans or MRIs, the payment may be different and you may incur more co-payments in situations like that. If you are in doubt, or I should say, you should always talk to the social worker or the hospital finance representative and find out where do you stand. What kind of admission do you have? And what's involved? What is going to cost you? How are they going to notify you if they change the status from observation to inpatient? These things are important because we just cannot go to the emergency room and say, okay, I'm sick, just take care of me. It has to be a team effort because medicine is very complex and it changes from time to time. Let's talk about skilled nursing facility. Let's say you were admitted with a pneumonia, or let's say Mr. X was admitted with pneumonia for 3 days. He got antibiotics, he recovered, and he's walking around, but he's too weak. He can't go home. He's 80 years old and he can hardly walk around. So the doctor decides, okay, we're going to send you to the skilled nursing facility or the LTAC, which I talked to you about. And there you can sit there and recover. They can provide you with rehab. They can provide you with more IV fluids. They can provide you with continued antibiotics. So we want you to sit there for 2 to 3 weeks, depending upon how much time you need to recuperate. And that is going to be under hospital Medicare Part A, skilled nursing facility. Here you get just like other semi-private room, meals, nursing care, and the usual care, even intensive care, respirators and breathing treatments, whatever is needed. But there's a catch. If you have to go to a skilled nursing facility. You can't just go from the house to the skilled nursing facility or from an emergency room to the nursing facility. Unless you were admitted to the hospital for 3 days and you spent 3 days in the hospital, you won't be eligible to go to a skilled nursing facility. But the Medicare Advantage plan may let you go from not being in a hospital to a skilled nursing facility depending upon the situation. Again, for everything you need clarification, authorization. Otherwise, somebody has to pay the bills. The first 20 days of stay in the skilled nursing facility is covered by Medicare. You don't pay anything. Between 21 to 100 days, you pay co-insurance. It varies, between like 20 to 60 days, it is a different tier. From 60 to 90, 100 days, it's a different tier. And beyond 100 days, any cost is all yours, truly. Finally, grandma had cancer, broken hip, heart attack, heart surgery, 89 years old, can hardly walk, and now the grandma is just not doing good. Grandma can hardly recognize the family members. So you all get together as a family, consult with the doctors, and you consult with the nurses, you consult with the volunteers, social workers, and the hospice aide, and feel, grandma has a incurable cancer. Maybe it's just good to just put grandma in a hospice care. Just make her comfortable. Give her some prime medications, some nutrition from IV fluids. Make her comfortable, because whatever we're going to do is not going to change. That's where the hospice care comes into picture, and that is covered by Medicare Part A. They cover the medical, nursing, social services. They cover pain management. They cover social and all these ancillary services that are needed, counseling. All these things are covered. And let's say grandma somehow makes little recovery and she's able to get around a little bit and talk, but she still has this incurable cancer. And 6 months go by and grandma is still getting along. That means you have to get a recertification from the team which I'm talking about to make sure that the grandma needs continued hospice care. And if you're getting any medications from outside, you have to pay $5 copay for pain medications. This is about hospice care. So ladies and gentlemen, this is a very quick overview of what Medicare Part A is. I know this is a long-winded presentation, but I have covered many aspects of Medicare Part A, which can last a lifetime by understanding what is involved, what is your role, what is your responsibility, more importantly, how do you work with the hospital doctors, the social workers, and the representatives so that you don't have any shock beyond the one you got from your medical illness. Ladies and gentlemen, I am Dr. Nik Nikam, and this Medicare update seminars are brought to you by Triple N Media. And please do subscribe to our YouTube channel, and I will see you in the next presentation on Medicare Part B. What does it cover? What does it not cover? And what is your cost?